So this is the part 8 of neuroanatomy. This is the last part most probably. So what we are looking at is branches inside the brain. So we are seeing its internal carotid artery. It is formed at the level of thyroid cartilage, that is at C3 level. Common carotid is divided into internal and external carotid artery. So internal carotid artery is laterally and external carotid is medially. Surface anatomy you can see here like this. This external internal carotid artery. Internal jugular vein is more lateral to this, anterior to sternocleidomastoid. So branches of internal carotid artery inside the brain. It has no branch in the neck, so directly it goes into the brain, and there it goes inside, no branches, but has branches inside the brain in the circle of Willis with vertebrobasilar artery. Ophthalmic artery is the first branch. This is the question, and supplies the lacrimal apparatus. Now, when it goes inside the brain, you can see this. This is the brain. Now you have to see this like this. This is internal carotid artery. It has come inside, and this larger one is forming the anterior cerebral artery. This is middle cerebral artery. This is anterior cerebral artery. So you can see anterior lobe and middle cerebral. Then posterior communicating artery. So these are the branches. Anterior cerebral artery, it affects the lower limbs on the opposite side. So if you see like this, anterior cerebral, middle cerebral, posterior cerebral. So it is towards the lower limb is represented. This is the motor part. So lower trunk is represented on the medial side. This is like false. So on the lateral side there is a hand and the face. So anterior cerebral artery is supplying the motor part of the trunk. Even if you see sensory, so lower limbs are represented more, the abdominal trunk is. So anterior cerebral moreover is supplying to the lower limb. Middle cerebral, so whenever there is infarction, this area, the lower limb is affected, upper limb is spared. Middle cerebral artery, this is larger area. It is largest branch of internal carotid artery. When it is occluded, sensory and motor loss, hemiplegia of the opposite side of the body. Again it is contralateral. Sensory and motor loss, opposite side of the body and lower face, lower part of the face. Then middle cerebral artery and anterior choroidal artery, posterior communicating artery. So it is like this. Now Broca's area and Wernicke's area. What is that? So you have to understand this representation. Middle cerebral artery is most of the supplying to face, and posterior cerebral artery is the different part. Sensory, again middle trunk. Now you can see this is the brain, this is the motor area, there is a sensory area. This one is motor, this one is sensory. This is Wernicke's area. The speech processing is done here, and then it is transferred to the Broca's area where speech production is in. Primary auditory visual cortex is in the occipital area. So when you see Broca's area speech production, Wernicke's is processing. So if you see posterior communicating artery, the subclavian artery, this is the important. You can see this is innominate brachiocephalic trunk. This is subclavian. This is common carotid. Innominate artery. So subclavian has got first branch is vertebral, lower down is internal thoracic or internal mammary, then thyrocervical trunk. These are the three, and you can see two nerves. This is sclencanticus muscle. This is one nerve, and this is another nerve. These are the two nerves. One is vagus nerve, and one is phrenic nerve. This one is phrenic nerve, is coming down and here inside thorax. This is vagus nerve in between the two vessels, subclavian artery and subclavian vein. Artery is anterior to the sclencanticus, so vein is anterior to sclencanticus and immediately behind the clavicle, sternoclavicle joint. This is behind this sternum. So you can see here subclavian artery, right from the brachiocephalic artery, right from brachiocephalic, and left from arch of aorta directly. Divided by subclavian arteries to three parts. Artery passes by ends by converting to axillary artery. So if you see, it is divided by scalenus anticus into three parts. First part has got three branches. One is with CD, vertebral artery, intermammary artery, thyrocervical trunk. Intermammary, thyrocervical. Vitamin C is costocervical trunk. D is dorsoscapular. So these are the branches of subclavian artery. So first is vertebral, internal mammary, thyrocervical trunk. The vertebral artery is the first branch of subclavian artery. Anatomically divides into four regions. It is going up like this. It enters to the sixth cervical vertebra. It goes up and joins with the opposite side vertical artery to form the basilar artery. Second part lies superior to the foramina and transverses sixth cervical. Third part runs posteriorly lateral masseter and one vertebral canal. Fourth part medulla oblongata. So this is from this side. Similarly, you get of opposite side, and here if you see, the arch of aorta is like this, and from here the vertebral artery is directly, this is common carotid, here will be common carotid of this side, and vertebral artery from subclavian artery. It will go like this, in this manner, and subclavian will be, the arch of aorta will go like this down, subclavian will be like this. So anywhere blockage here before, so blood will be traversing like this, subclavian steal syndrome. So this picture you can get arch of aorta, right brachiocephalic, vertebral artery, left side subclavian. This is common carotid. So anywhere blockage here, then what will happen? Whenever left side hand is working, so blood will flow like this. That is subclavian steal. Branches of basilar artery. Now basilar artery, these two join together to form the basilar artery. Labyrinthine, pontine, pons, posterior cerebral artery, occipital visual cortex. So basilar artery is supplying to visual cortex. Superior cerebellar artery, anterior cerebral artery. Vertebral artery itself is giving pica, posterior inferior cerebral artery, largest branch of cerebellum, anterior spinal gland. So cerebral ataxia mainly caused by pica. Whenever there is some blockage into this artery, this will lead to now artery of Adam-Kevis. You can see origin from the intercostal supplying spinal cord T8 to conus medullaris and anastomosis. Ischemia affecting leads to urinary and fecal incontinence. You can see this is the descending aorta. You can see from this intercostal artery, it gives a spinal branch, posterior radicular artery, anterior and posterior, and this is artery of Adam-Kevis. This is important structure. Spinal cord ends at L1 level in adult, L1, while L3 in the pediatric. It goes down little bit. Spinal cord below L1 contains cauda. So L1 and below, this will be cauda equina or lower motor neuron lesion. Lumbar system at S2, cisterns, end of CSF at S2 level. This is S2. CSF is up to this level. Spinal cord attachment for phylum terminal. This is directly attached here. Denticular determines suspends spinal cord to dural sheath. Now if you see, these are nerves like this. This is dorsal root, this is ventral root. The two join, there is a ganglion, dorsal root. Now if you see the vertebra, this is the body, this green color is pedicle, this is transverse process, this yellowish is articular process, with lamina and the spine. So cervical vertebra first is atlas, second is axis. They form a joint called as atlantoaxis. The dense odontoid process. Atlas has anterior arch, no body. You can see this. This one is atlas. There is no body. There is just arch and posterior arch. There is no spine also behind. Cervical spines from C1 to C6 are foramina. Transverse. These are the transverse spines. Mm. This is the, you can see, this is a transverse process, cervical transverse, and this is the spinous process. This is transverse process. Cervical spines from C1 to C3 have foramina in the transverse process, then passes on the posterior arch of atlas. So all these transverse processes goes in foramina. So these are the three. First is the anterior line is the body, posterior line, and this is about the transverse process. Intervertebral disc. Intervertebral is formed by inner nucleus pulposus and outer is annulus. You can see inner is nucleus, outer is annulus. So disc result from bulging of the nucleus pulposus or deficient annulus. Vertebral canal contains spinal cord. Intervertebral contains. So this is the intervertebral foramen contains spinal nerves. Vertebral canal contains spinal cord. If you see the ligaments, supraspinous. This is the spinous tops. Each other are connected by supraspinous. Then this is intraspinous. Then ligamentum flavum. The anterior longitudinal ligament, posterior longitudinal ligament. Then in between anterior and posterior longitudinal ligament, there is yellowish color is the spinal cord. So there are intertransverse ligaments. These are the intertransverse ligaments. So whenever pathway of lumbar puncture is there, first you have to go supraspinous ligaments or interspinous ligaments should be first. Interspinous or supraspinous between the spines. Then ligamentum flavum, supraspinous, interspinous, ligamentum flavum, then arachnoid and subarachnoid space. 1, 2, 3, 4, 5 subarachnoid space puncture. If the bleeding occurs, it is vertebral venous plexus in the epidural space. Level of lumbar puncture L4-5 or L3-4 at the level of iliac crest. There is no specific level for epidural puncture. So this was about end of neuroanatomy.